So we have talked about osseointegration before here, and just as a refresher, osseointegration is basically just the surgical insertion of a titanium implant that goes directly into the bone. And so human bone is then able to grow into and around the implant, causing a permanent connection that really gives the patient a very realistic feel. So when we've talked about osseointegration before, it was really only about leg prosthetics, but now that osseointegration technology has really advanced, we're moving into more upper limb prosthetics. So with legs, a patient can go through osseointegration and the whole process and almost immediately use their new prosthetic, whereas an upper limb prosthetic takes a little bit more time and practice to perfect and use comfortably. If you think about it, the legs and the hips, they make larger, more unrefined movements like when we walk, while parts of the upper limbs, they make more precise movements that require more thought and more control, like using your fingers to pinch something or to press a button. To combat the differences in these implants, a lot of surgeons are leaning towards a process called TMR, or target muscle reinnervation, which is basically just a fancy way of saying you're rerouting the nerves to the new implant to give the patient more control and be more comfortable in their new implant. Osseointegration is already a very invasive and a somewhat long process, so surgeons have started performing both the implant surgery and the target muscle reinnervation surgery simultaneously to cut down on the total number of surgeries a patient has to go through and also some of the complications that come along with multiple surgeries. Osseointegration and muscle reinnervation both independently change the prosthetics game, and now the combination of the two procedures is once again going to change the world of implants.